patient quality of care in nursing homes. Does staff job satisfaction matter? The days of families staying home to be caregivers to loved ones is becoming more uncommon. Society has changed drastically over the last couple of decades. Aging baby boomers, longer life expectancy, and higher costs of living are shifting to our dependence on skilled staff and nursing homes. We hear in the headlines that the erosion of quality care and lack of regulation in some nursing homes can lead to abuse, neglect, and even death in some situations. On the other side, staff in these nursing homes can be underpaid and overworked in less than satisfactory work environments. In the literature review, I discovered a lot about employee morale and job satisfaction. Bullying is one area that impacts interpersonal relations of staff and residents and has been studied pretty heavily. Research demonstrates that merely having bullying in the workplace of any kind can lower employee morale, reduce commitment and job satisfaction, and lead to breakdown of interpersonal relationships in the workplace. Bullying amongst coworkers impact job satisfaction, but the way residents treat staff also impact employee satisfaction. Highly depressive residents and residents with behavioral problems are a significant source of stress among employees caring for the elderly. In regards to job satisfaction, the literature looked at two variables, both the intrinsic and the extrinsic. The intrinsic satisfaction is related to the nature of the job and involves accomplishments, self-esteem, capacities, and responsibility. It has been found that intrinsic factors, like the increasing value of work, reduce employee turnover. Extrinsic satisfaction is associated with the work environment, including salary, company policies, interpersonal relations, and stability of the job. Extrinsic factors such as leadership behaviors, empowerment, and commitment also have an impact on overall job satisfaction. Many of our future geriatric population are going to rely heavily on nursing homes and their staff to live out the latter days of life. This vulnerable population deserves respect, integrity, and quality of care. Nursing staff should be empowered by knowing that they are making a difference in the lives of others and what they do matters. Low job satisfaction of staff is likely to impact the quality of care of residents in a nursing home. The research design of the proposal is a quantitative study. The independent variable will be staff job satisfaction. Participants will be administered questions using a standard instrument job satisfaction index developed by Schreisheim and Choi. It uses 6 items to form an index that describes overall job satisfaction. The scale includes single questions to assess the degree of satisfaction with the work itself, supervision, coworkers, pay, promotion opportunities, and the job in general. The dependent variable, quality of care, is going to be defined by the Nursing Home Compare tool available on Medicare.gov. A stratified random sampling method will be used for the proposed research. Employees of 3 different nursing homes with varied quality of care scores will be invited to complete a voluntary survey via a link sent to their employee email. After clicking the link, participants will be told the survey is voluntary and confidential and be asked to complete the informed consent form. A copy of the informed consent will be included in the proposal. Individual participant information will be confidential. Which nursing home the staff is employed will be identifiable as part of the survey process. In order to participate, the only requirement will be to be an employee, full, part, or contingent of the selected nursing homes. No other restrictions are being considered at this time. collected over a 1-month period using an online survey. The survey will be designed to include demographic information and the Job Satisfaction Index. Upon clicking the link, the participant will need to read and electronically sign the informed consent statement. The participants that do not agree will not be forwarded to the demographic questions or Job Satisfaction Index. They will be thanked for their consideration. Participants who do agree will move into the demographic questions, and then one Job Satisfaction Index question will be presented at a time. A response will be required, and only one response can be selected before moving on to the next question. Upon completion of the survey, the participant will be thanked for participating and provided information about the availability of the final results. Ethical considerations. Ethical considerations include the informed consent form. On that form, it will be outlined that they will not be harmed by participating in this research, and all efforts will be made to keep their privacy and confidentiality. We do not want the participants to feel that there's any chance of retaliation for being honest on the survey. Cultural considerations, that would include the environment in which they work in. Patients are often ill in a very vulnerable population. They are also in a heavily regulated industry, and their day-to-day operations have direct impact on the lives of others. Data analysis. For this research proposal, once the data has been collected, I propose that a correlation coefficient analysis be ran against the mean job satisfaction scores and the quality of care scores that are provided on the Medicare.gov website. The number of nursing homes and elderly that will need to be provided care is only expected to increase in the years to come. If we can show a correlation between job satisfaction and quality of care, this could be an area to provide more attention and resources to. Staff are an integral part to the day-to-day operations of a nursing home and should be valued accordingly. For some patients, the staff may be the only human interaction they have. The elderly should be treated with dignity and respect, and if staff are the ones that we give this responsibility to, shouldn't the same be provided to them?